Hello, everyone. Welcome to the second TMLS Virtual Micro Summit dedicated to the healthcare COVID-19 response. My name is Nadia, and I'm honored to be here today and to have the opportunity to introduce one of our amazing speakers. Before starting, I would like to remind you all that in June, TMLS is hosting a Machine Learning Ops event, a 3 days fully virtual conference. You can find more information about the event on the reception page in case you are interested. Also, please do not click the share audio and video button. You do not need to click this button to watch the talk. Moreover, if you have a question, please post it in the chat. I will personally collect all the questions to ask them directly to our speaker after the presentation. Let's start. Our speaker is Christina White. Tina is an aerospace engineer turned applied machine learning researcher. After her master in aerospace engineering, she invented and patented a method for eliminating transonic flutter in turbomachinery at Honeywell. While at Stanford, Tina developed two novel machine learning methods for faster and more accurate reduced order models. For her dissertation, she designed several neural network architectures that are biased to break problems into parts while learning to make aerodynamics prediction from very few examples. Currently, she's working on a project to stop the spread of COVID-19 using Bluetooth for decentralized exposure alert. Please join me in welcoming Christina White.
Hi, thank you for the introduction, Nadia. Go ahead and get started. So I wanted to talk about a project that I've been working on for a few months now. Started in mid-February. It's an anonymous exposure notification system for using mobile applications to stop the spread of COVID-19 while having a particular focus on preserving user privacy. So I kind of want to talk about, I'm representing a pretty large group of people at this point. So this started just as a research project with me and a few other collaborators from University of Waterloo, but it has grown a lot since then. We have a very large volunteer team now. About 450 people are in our Slack workspace, and we have many advisors from Stanford and outside of Stanford and Waterloo, and about 40 people that are actively now working on building a mobile app that implements a notification system for COVID-19, but without collecting any personal identifying information at all. So we've developed as a kind of messaging system that is anonymous, that we're excited about, and that we hope will be used instead of apps that are more likely to perform things that are intrusive on your privacy and that might be co-opted for surveillance. So this is what we're trying to avoid. And it all started end of January when it's the same time it started for everyone else, seeing the news out of China. And I guess I felt first seeing this near the end of January pretty helpless. And then in the first week of February, there was this article that I saw about China's app that is used to inform people of their risk, but also uses kind of the full power of their surveillance capacity that they have, which is a lot. So looking at this, this is what I was also very concerned about, because something like this will come to the United States too, and is likely to do that, and is currently something like this is currently happening, where there are definitely many apps out there that are being developed that might be used for surveillance, that are using GPS, that are using centralized Bluetooth. So we got started a couple months ago trying to think about whether there are ways to perform an intervention that alerts people to their exposure and gives them a better idea of their risk, but that doesn't need to collect a lot of personal information to do that. So we started this research project and looked into the different kinds of data that your phone collects. So the first thing that I thought of, and the first thing that my collaborators thought of, was GPS. So we started looking into how GPS could possibly be anonymized, how you could use that to see if you were close to someone who, or interacted with someone who may have had COVID-19 in the past and then be alerted later. But the more that we looked at GPS, the more that we realized that it's very, very hard to anonymize GPS. A location is not that identifying, but an entire GPS trajectory, people's trajectories are very unique. So this is very hard to do. And it was discouraging to us. And around the same time, we ran into a team that was working on, or that had existed prior to COVID-19 as a regular flu tracking or tracking app that not necessarily for tracking, but for alerting your friends whether you have the flu or they have the flu, in order to kind of form this protective bubble around your community, that you're less likely to get the flu because everybody might have an app that notifies them if their friends have it. So that was their idea, and they suggested using Bluetooth for this, that it's a better measure of proximity between people than GPS. This GPS also has other issues besides that it's difficult to anonymize. It also is hard to tell whether two people are close to each other in a few different circumstances that really matter. For example, if you're on different floors of the building, that's very hard to tell with GPS. Or if you're on the other side of the wall, it looks kind of the same as if you're 6 feet apart from somebody, but you're in the same room. So that's very hard to tell. But with Bluetooth, that signal strength goes down in between walls, which is a great thing because it's a better measure of functional proximity in places where it matters, like inside buildings and where a lot of transmission takes place. So the other thing that made us excited about Bluetooth, besides that it was a good measure of proximity, was that my collaborator James Petrie from the University of Waterloo came up with this decentralized privacy model in order to alert people, but without having to collect any identifying information about them. So here was our first explanation, which we put in our white paper about how it works, from March 20th, which was the first time that this decentralized model appeared anywhere. So this was sort of a novel form of intervention for possibly sending these anonymous alerts. So the way that it works is, if two people have an app like this installed and they come within a certain distance of each other and are within that distance of each other for about 15 minutes, probably about 6 feet, 2 or 3 meters, then what will happen is each of those phones at all times is sending out occasionally these random numbers or broadcasting them using Bluetooth, so that other phones that have the app can see that they're around. And what they're broadcasting is a number that's changing all the time. So it's this random number that every few minutes changes, so that it's not associated with that person or device, just a generated number. Now, if you're near another device with that number for the right amount of time, what will happen is your phone will log that number that it was seeing, and it will log the number that you were broadcasting at the time. And so as you run into more people or you have more interactions, your phone will continue to keep this log of random numbers that don't really correspond to anybody. You could, again, run into the same person. It'll be a different number that time. There's no way to know if it was the same person. And then the two numbers will also be logged on the other phone. So this is kind of exciting because this form of communication is direct between the two phones. So there's no middleman. Like, it doesn't go up to a central server somewhere. It doesn't go, there's no one that can really intercept it, because it's this direct local communication between the phones. So it ends up being this very private way of exchanging these numbers, kind of like a secret password that later you can use to inform the person that you interacted with without them knowing that it was you. So the way that that works, if later you're confirmed positive with COVID-19, you can put that into the app and say that I was positive. And if you say that you were positive, then we don't get that information, but instead what we get is that list of numbers that you have from before. So normally that log of numbers just stays on your phone, and then if you're positive, that log of numbers will be shared with the other phones. And again, no identifying information in it, just the random numbers. However, if another phone remembers one of that numbers and it appears in its log, then that's how it knows that it was exposed for a significant period of time. And then you could have this alert appear in your phone that tells you that you were exposed. So this is a pretty cool and elegant system for informing people of their risk without having to collect any identifying information about anyone. And it's kind of useless for any other purpose. So after a few weeks, you just delete the numbers. And it's very simple and a very small amount of data that is even needed to be shared with everyone too. I think one of our estimates is for the entire state of California, for example, the amount of data that we need would be around something like 2 megabytes, so like a very small, or like not a high quality image, but like a medium quality image would store all of that. The size of that, about 2 megabytes, would contain all of the data that we need for the entire state. So we're collecting very, very little data. There's no server farms that are needed. It's just a tiny amount of data to perform this anonymous messaging system. So we're very excited, and we started actually building it as well. So another co-founder of our nonprofit had background or experience with Bluetooth, and we built the first version of this system into iOS and Android devices, that if they're near each other, they log these random numbers. And if later you report, here's just sort of an academic demonstration of this. Then the other phones get informed. And around the same time, we were building this system, there was a great Oxford study came out showing that something like this, if 50% of the population uses it, or 56% of any community. So perhaps you, your friends, everybody that you're in contact with, if a little over half of them are using a device like this or have an app like this installed, then that would stop community spread within that community. So the more people that community then shares it with, kind of forms this, creates a little bit of a protective bubble around you and your friends and everyone who it's shared with. And that data is not shared with the government, it's not surveilling you, it's just something you share with each other. So yeah, so our team accomplished a lot in a pretty short period of time. We all worked very hard, started on February 19th. First team to open source what I just showed in the phones, actually performing the Bluetooth exposure notification. We're also the first team to publish a decentralized privacy model and created this proof of concept that Bluetooth communication works, and joined a bunch of other apps that together kind of wanted to advocate for these kinds of decentralized systems. And then recently, Google and Apple announced that they're building something very similar, or they're providing APIs so that apps using this kind of decentralized system can get access to like better connectivity, because there were some bugs and issues on Apple that made the connections not really perfect. So some of them were missed. But now that they're providing these APIs, the connections are much better. So there are fewer bugs and errors, and we're excited about that. So the very simple description of how it works is something that I kind of already explained, but we sort of tried to put together. I think one of the challenges that we're facing going forward is that there are other apps that have been developed. For example, centralized apps in Singapore, and people are looking into centralized apps in Australia, and we're considering it in Germany, where instead of this decentralized system that I described, they don't share random numbers, but they share numbers that are associated with your identity. So if you build the system that way, you end up getting all kinds of new information about people that didn't really exist as a form of surveillance before. And this is what we're trying very hard to avoid. So we're, it's a bit of a challenge because we have to differentiate our system from these other systems that are now out there that are much more invasive, and have to deal with issues like public trust in these kinds of systems because of the fact that Bluetooth systems now already exist that are much more intrusive and much more surveillance friendly. So we have to talk about our method in a way that is easy to understand and explain that the numbers in this are used only to anonymous notifications. So yes, so these are kind of to communicate this information that no personal data is collected by the app. There's no central ID database, as there are in these other systems that have been developed that are centralized. Like what we've seen through surveys that we've looked at is that a lot of people want something like this, but what happens is if it comes from the state or from big tech or big, then people start to not want to be tracked and surveilled. So I think really in the future going forward, the challenge is more about telling the story in a way that it's clear that this is indeed privacy preserving, that it's anonymous, and that it is very useful for helping something that you would want to have and share with others so that people are alerted earlier, so that you have a little bit of personal power too over your network and whether the virus spreads within the network of people that you interact with. And what's next is there's a lot of different apps out there with very different privacy models. So there are only a few that are using decentralized Bluetooth, like the ones that we've developed. So there's these other groups, TP3T and PACT, who only a couple weeks after ours developed very similar versions of the same thing. And again, the Google-Apple protocol will provide the same sort of functionality. And so a few countries have announced that they're interested in this. But there are also other apps out there that still either are collecting GPS data or they're collecting centralized Bluetooth data, like Singapore and Australia and France and currently the UK, although they're still doesn't seem like they're entirely decided yet. So there's really a range of different possibilities that could happen in the future. You could have something that's very surveillance friendly, like a centralized Bluetooth app. You could have an anonymous messaging system, which we were trying to advocate for, which is very protective of people's privacy because it doesn't collect any identifying information in the first place, which is the best case scenario. And then there's kind of things that are in the middle that use GPS but try to anonymize it and still use decentralized Bluetooth but can add on other things. So now we're continuing to build an app like this, and so are a lot of other teams in the world now. There's plenty of space for lots of other different teams, as long as they're building apps that have interoperable servers and backends. And really the next thing is to think about how to communicate what we're doing in a way that is more empowering rather than feeling like you're being tracked or traced, which is what more centralized systems would be doing. And explain that what we're doing is really trying to help people out and give them a little bit of power over what's happening directly in their community and people that they're interacting with, by being able to notify people sooner through the app and being able to be notified sooner themselves. So we're sort of continuing to build this app and put together our messaging in a way that communicates well. And that's where we're at now. We're at the stage where we have beta apps that you can download, and we're hoping to pilot and actually use the system that we created. And we have several different advisors at Stanford and Waterloo who are helping us on this project and are continuing to work very hard on it. So I think I finished a little bit early, and I'm happy to start taking questions.
Thank you so much, Christina. It was an amazing presentation. So
yeah.
I've collected most of the questions, so I'll start in order. Okay, so if I understand correctly, the person that tested positive informs the app. Any idea what the compliance rate will be?
With the compliance rate?
Yeah, correct.
So that's what's a little bit tough to estimate because we're leaving that to be a voluntary choice, whether you self-report or not. And the self-report rate that we would need is the percent that I suggested before, which is around 56%. And currently, there have been a couple implementations of similar apps, although there have been no decentralized apps yet, so it's very hard to say because it's a new technology and it hasn't yet been piloted. So we don't know how many people are going to be able to, how many people will self-report. With centralized systems where there was a lot of public backlash against their privacy models, they achieved about 25%, which is not quite enough. I still think it would be a little bit helpful, but it's still a bit too small to really make a big difference. I think we need somewhere around 50% to really make a big difference.
Thank you so much. So in case you have a follow-up question, please post it in the chat. I will also ask the follow-up question. So the next one is, do you have a link to where someone could download the app?
Yeah, so we have a beta app, and we could easily send that out. And we also have a beta on Apple right now, and then we should have the one on Android in a couple of days. But right now it's just a beta system, so we aren't sharing the link with a ton of people because there's sort of a limit on how many people can be underneath the beta.
Awesome, thank you. So let's move to the next one. How would this be marketed to people to use? What mediums would you use? How would you craft the message?
So I think that's the next big question. I think it's a really important one because adoption matters so much. I think the next stage for our team is to really start thinking about that. So the original team that we had run into that was building an app for the regular flu had more of a grassroots design of starting with a small community of people and then sharing it with their friends and then sharing it with their friends because it is actually useful and it is something people want. But that takes time. So some amount of PR or public messaging about how the app works. Yeah, we might need to do a range of different things, and it's unclear yet what the best approach is. I think having a successful pilot is also one way for us to get our message out to. We're maybe going to try at universities or if there's still essential workers that are going out and having to interact. Piloting among some essential workers or at a university is something that we could do, and seeing a success case would be something that would help a lot.
Awesome. Okay, so next question. I see that I can donate to COVID Watch. Would you talk a bit about how funds would be used?
Yeah, so our team is a nonprofit, and funds would be used. Currently, we only have volunteers. We have a few people that we have started paying who are key engineers and developers. So it would be used to pay people working on it. I think about 95% of the work that has been done on this product has been a volunteer effort so far. Only a few people are getting paid at the moment, and we're fundraising so that we can start to pay people who do heroic efforts to get this done. That's what it would go for.
Awesome. So next question. We have two questions that ask similar things, so I will sum up in one only. If there are multiple apps, can they talk to one another? So if there are multiple similar apps, can they talk to one another?
Yes, they can. So you kind of have to put some effort into it. Like the apps have to interact a bit with each other just to make sure that they are sharing the data. Also, if you build very different systems, then they could be not interoperable. However, because of these, so Google, Apple released some APIs, and those APIs have like their specifications. As long as everybody is like switches to that standard, then that constrains the space a lot, so that mostly that issue is taken care of. There's still like a few choices that you can make about server design that might make things not interoperable, but it should be relatively simple from this point forward to make apps that are easily interoperable, and they would just need to start coordinating to share the information with each other.
Awesome. Thank you so much, Christina. Now we have a more technical question. What happens if there is a collision of the random IDs?
You mean if there are multiple of the same ID?
Yeah, I think they mean if the two identical IDs are generated. So when you finish up your...
So I think we've controlled a lot for collisions by just having very long numbers for the IDs, so it's very unlikely that there will be collisions.
Cool. Okay, another question. When someone self-labels via the app, does this retroactively provide info to people they were in contact with?
When reports in the app?
Yes, self-reported itself as sick.
Yeah, so if you self-report, then the people you've interacted with in the past, those are the people who would be alerted.
Awesome. I
in
think
the past,
we have...
when you were possibly just, then yeah, those are the people who would be alerted.
Okay, I think we have the last question here. Okay, I think it's more a multiple question. So, can this use can this use for social distancing in general? Is there machine learning logic behind near concept, or are they equidistant to multiple users nearby?
I missed the very end of the question.
Okay, is there machine learning logic behind the near, or there is like a nearby concept? So how do you define?
So the way that we try to estimate what's near is based on signal strength from Bluetooth. So we should be able to get RSSI measurements and try to infer devices are closer than other devices based on RSSI and get somewhat of an accurate estimate of distance. Based on the paper that we saw about this, it should be accurate to about 2 meters, which is all you really need. So it doesn't need to be perfectly accurate. We do think it will be a bit noisy, but there's no perfect system, and most likely we'll catch a lot of we should catch most interactions accurately, and exactly where to draw the line is something that still needs to be explored more, but we based on feedback, we intend to draw the line somewhere around 2 to 3 meters apart for about 15 minutes.
Okay, we have other questions. So, okay. One question is about the capability of walls detection.
So what happens with Bluetooth is that, like if you're on the other side of the wall, like for example, if I have my headphones on and my phone is in the other room, then it could start to get start to cut in and out because the signal strength is down considerably through a wall. So what will happen is we cut off at a certain signal strength, and it's very likely to be much higher than where you'd be at if you're hearing a signal through a wall. So a wall like significantly reduces it so much that it'll go beyond that cutoff.
Okay, just a reminder, if you have a follow-up question, put it in the chat. I will ask the follow-up question too. This other question is about time frame. does the app take into consideration when the interaction with the sick person happened?
Yes, so the data that ends up being generated, so you'll generate one of those random numbers and a timestamp, so that after 2 weeks, the random numbers can just be cleared, so they're no longer even stored locally on the phone. And also then you also know when it happened, so that when somebody reports positive and like symptoms started on this day, then you only inform the people who interacted with them during the period when they possibly were infectious, so maybe the week or 2 weeks before that, whatever that number is, whatever the current number is for COVID-19, and then we would only alert those people. So we need just the random number and then the timestamp.
Okay, cool. There is another question that's kind of similar. Will only the first cycle of people be alerted, or there is also a second cycle?
Second cycle. So yep. It is possible that you could build a second database which operates on the same system. So the first group of people would get alerted that they have been exposed. And so our version 1 doesn't have this. It's kind of complicated to do both. So version 1 just has one level of alert, but you could build a system so that there's a second level of alert. Like, should you also alert your friends that you've been exposed right now? And so perhaps you could get like a red alert that you have been exposed to somebody positive, or maybe in like a yellow alert that you have been exposed to somebody who was exposed to someone positive after the fact. Something like that we could do, and we could still use anonymous messaging system to do it.
That sounds very awesome. So probably we have the last question again. So with apps like this, is it possible to use the anonymous interaction data to study the mechanism of community spread through infection rate?
So it's very unlikely that we can get any data that's very useful for research out of this. We might be able to get numbers about this is the number of people who reported, and we could get this is the number of alerts that were sent. But because we don't collect any identifying information, we can't really trace the spread of the virus from one person to another. So there's been a lot of people want to build centralized systems because they want to do research on it. But then once we talk about how, well, you need to create a central database to do that, and that kind of enables surveillance in a way that is new. So it makes sense why people want it. It's often people who want to do research. But the system as designed really is only for sending the anonymous messages. Can't get much out of it. It's kind of useless for anything else but what it was designed for. So you can only really get sort of raw numbers out of this is the number who self-reported, and this is the number of alerts that were sent, and just very basic.
Okay, cool. I lied. There is another last question.
All right.
So, can this system be updated for security alerts to do localized notification, for example, during an active shooting situation?
I would doubt that. So it's really meant to alert people who were near each other in the past. So Bluetooth works to do both of those things. It could tell if another app is close to it, and using its exchange of like that password or that shared number, so you know action. So it's a different system. I don't think it would apply to active shooter situations. And it's really kind of specialized for this, for something like COVID-19 or for something like virus spread. It could be used for the flu or possibly other, like if there's another pandemic or another wave of COVID-19. Yeah, it's hard to think of other situations where you need to be informed of that. It's really specific for COVID-19. I think that's what we're building it for, and it's possible you could think of other applications of the technology, but I think this is yeah, it's designed for COVID. I don't really see it working in active shooter. I'm trying to imagine that working, but I'm not quite sure that would work.
Okay, thank you so much, Richard. Let us know if this answers your question. So we do have another one. Is it possible for a bad actor to abuse the system to release incorrect infection information?
So if you allow people to, unfortunately, not everybody is honest all the time. So people could self-report incorrectly. We've avoided that by what you'll need in order to use an app like this is permission. So whoever diagnoses you positive, like either from a lab, can give you a permission number, or now everybody who is positive needs to interact with a contact tracer. So the positive person goes and talks to a contact, and they trace their contacts. It's manual contact tracing, and that's happening, or starting to happen, everywhere. The other permission number is you talk to the contact tracer anyway, and they can give you a permission number to put into the app. So either labs or contact tracers, it's kind of unclear right now what's the best way to get permission. But I would prefer if we could just self-report and didn't have to worry about bad actors, but because you don't want false reports, you need some way to confirm that, yes, this person was positive with COVID in the app. So you need to get that either from labs or from contact tracers.
Okay, so I think there is kind of a follow-up. Someone is asking if it can be used for measles as well.
So it's particularly useful for COVID-19 because of the asymptomatic infectious period that a lot of people have. So with other things like the regular flu, it's a little less effective. So there are really only certain conditions where something like this is very useful. And I'm not sure if measles applies. I think it could still be used, but it's particularly useful for COVID-19 because of the asymptomatic infectious period.
Awesome. Okay, so that was the last question. So thank you so much, Christina. It was really such an interesting presentation. I like to see how technology is used for fight this and to serve the community. So a lot of thank you also from the chat, and thank you guys. You can go to follow up the other session. Don't forget to go in the main page where you can also find information about the MLOps event. Thank you so much, Christina, again. Bye.
Thank you so much. Bye.